In the second part of the lab, we're going to focus on veins. So here you have your major lab items, and the veins that are listed here are the ones you're responsible for. Remember that with veins, they usually correlate many times with the artery that parallels right next to it. So the vein lies on top, underneath that would be the artery, and underneath both of those would be the nerve, and many times sharing the same name. So if we start with the chest cavity again, we can recognize the superior vena cava, of course coming into the right atrium, and then the branch off of that is the brachiocephalic branch. So brachio is eventually will go into the arm, cephalic, it leads off into the jugular veins that are draining the brain and the veins that are on the skull. So notice your internal jugular comes out of the jugular canal, and or the jugular foramen, and coming down into the brachiocephalic branch. Your external jugular, of course, coming down from the outer side of the neck, and they merge then, and coming in from the arm you have the subclavian vein, number 5. Then taken up from the subclavian, you have the axillary artery. Again, it lines up with the axillary part of the underarm. Okay, so the axillary artery coming in, and the axillary vein is right next to it. Then you have the cephalic. Cephalic means cephala, head. So you have the head of the humerus here. That branch off of the axillary will form the cephalic vein. Then you have the brachial vein. We know that this part of the humerus is the brachial area of the arm. So you have the brachial artery, you have the brachial vein lying right over it, and then you have the basilic vein coming down the backside of the femur, or sorry, the humerus, backside of the humerus, and then it crosses over in the antecubital area into the median cubital vein. So that's where a lot of venipunctures will be done, in the median cubital vein. And then of course in the forearm, on the radius side you have the radial vein, and on the ulnar side you have the ulnar vein. In the abdomen you have the hepatic portal vein. So you can see that there's several of these that come off of the inferior vena cava, and they lead of course from the liver back into and empty into the inferior vena cava. There's also a vein that drains your stomach and the gastric region, so that is number 15, the gastric vein. Then the one coming out of the spleen into the inferior vena cava is the splenic vein. You have the splenic artery, red, the splenic vein, blue, and then the ones coming mimicking the renal artery from each kidney, draining each kidney, number 17 would be the renal vein. And then we said 13, this whole large structure is your inferior vena cava. Then of course you have the branch at the common iliac, and then remember you had the common iliac artery, the external iliac, and the internal iliac artery. Well, now you have the common iliac vein, you have the internal iliac and the external iliac vein. In the leg, we had the femoral artery. Here the femoral vein has been cut away, but it mimics again the femoral artery coming in there at the head of the femur and the shaft of the femur. Then of course you have the deep femoral that goes deep into the leg, just like you had the deep femoral vein and artery. Then you've got a vein where we didn't have an artery. So you have coming down the back side of the leg and the back area over the gastrocnemius, you had the posterior tibial artery, but here we have the great saphenous in the back and the small saphenous vein in the front. Okay, so those saphenous veins are there, and they show up on the model from the lab book, but you also can see that you do have an anterior tibial vein, but it's not shown in the model. It's been cut away. As far as the aortic arch, remember you have the aortic arch, you have the brachiocephalic branch, the middle one is the left common carotid artery, and then the left subclavian artery. The reason that these go directly into those arteries is because the heart is located toward the left side of the chest. So the brachiocephalic go into the arm brachio, and the head cephala branches into the right common carotid to go up to the right side of the neck and head, and the right subclavian to dip underneath the right clavicle. So make sure that you add this part of the aortic arch, the brachiocephalic trunk, left common carotid, and the left subclavian artery, to your study notes so that you also can get the right subclavian and the right common carotid labeled. As far as the histology, remember from lecture, you have a capillary bed. The arteriole fed in the oxygenated blood into a medarteriole. You had the capillary where the exchange happened, and then the thoroughfare channel come out the other side into the venule and eventually veins. So histologically, remember we talked about that arteries always have the open lumen. They have the thicker tunic. So you have the tunica intima or interna, which is the thin endothelium that lines the lumen of the artery. Remember, you have this very thick tunica media, and then you have the tunica externa that's fed in by the vasovasorium, or the arteries, to nourish this tissue. Where veins, on the other hand, don't have those three distinct layers as pronounced as an artery does. Also, we know that veins collapse, so the lumen of those collapses, where the actual volume inside of a vein, because it is a collecting vessel, is quite large. And then down here on the opposite side, you have the tiniest of the vessels, which are the capillaries. So artery in the middle, thick, smooth muscle layer in the tunica media, open lumen, a collapsed vessel, which is the vein, and then the tiniest of those are going to be the capillary.